really is a huge organisation. It's got many facets. So there's allied health support, there's podiatrists, OTs, physios.
Merri Community Heath Services is one of the largest independent community health services in Victoria. Being such a large organisation brings with it some unique opportunities as well as challenges.
The point of difference for Merri Community Heath Services is around our ability to provide wraparound services for our clients and our carers. We do provide multi-services, so we're affected by multiple reforms. Being able to address the range of reforms and being responsive to them is really critical for us. So that is something that I think is more unique to larger organisations, because we've got to deal with lots of fronts.
The Workforce Innovation Network's Reform Ready Review has been a critical element in Merri's response to the aged care reforms.
It's been a really good way of engaging people at different levels of the organisation. The range of things that we need to do in order to prepare ourselves for the changes requires a whole of organisation approach. And even with our staff, who have been quite anxious about the uncertainty and the complexity of the environment, they're now starting to engage in conversations about, okay, within this time frame we're going to actually work on this aspect, then we're going to move to this next step.
The review highlighted 5 key areas: workforce and business development, sustainability, quality and marketing. Workforce planning and development was shown to be critical in a competitive care environment.
Workforce is a very key one, that you need to have the right staff with the right skills in order to provide the right service.
We've been working with our staff on looking at what the clients want, not what they want, and how we're going to deliver that. We did some training and we have a really exciting page that says to the client, what do you want? Why are you coming to us? What do you want to get out of the group? What would you like to get out of it? And it's an ongoing living document that we change and we can add to.
In response to the review, Merri Heath Services has chosen to invest in a co-contribution tailored grant for 2 of the areas.
One was around the development of a workforce plan, and the second was to develop a marketing communication strategy to work with really 3 key population segments. One being our third-party providers. The second area we identified was obviously working with clients and carers, and the third is our referrers.
Being part of the WIN project has helped large businesses like Merri identify the changes needed to survive.
So don't sit back and wait, start looking at it and start having a critical analysis of where you are and what you've got in place and whether it's going to need to change, because you're not going to last if you've got the has-been style and you haven't done some work to get to the will-be style.